Right now, we're going to pivot quickly and get you out to Grady, where the chief medical officer is speaking about those victims.
As of today, 3 of them are in intensive care unit. 1 of them is in stable condition in one of our medical units. 2 of the 3 in critical care are going back to the operating room today for additional procedures. The 3rd patient is stable. Hopefully we'll be able to move out of the ICU today. I have had the opportunity to speak to either the family or the victims today. The families are incredibly appreciative of the support they've received, not only from the hospital, from the community itself, and the victims with whom I was able to speak have expressed the same thing. So as of right now, everybody is as stable as they can be given the nature of their injuries.
Dr. Jansen, the 2 who went back to the OR, was that unexpected complications that came out?
No. This is unfortunately a fairly routine thing after these types of injuries. You can't do everything during the first operation, so going back is a scheduled event.
So Dr. Jansen, just to clarify, the 3 in intensive care are still listed in critical condition, is that correct?
I haven't looked at what they're listed. The 2 of them are definitely still critical. 1 is stable and should be able to move out of the ICU today.
How would you describe any of the wounds?
Pardon?
How would you describe the wounds, Dr. Jansen?
Well, I'm a little reluctant to get into the nature of the wounds because of the privacy of the families and the patients. When they give us permission to talk specifically about that, we'll do so. But I'm a little hesitant to get into that because of their privacy.
On the arrest warrant today, it indicated that one of the shooting victims was shot in the arm. Is there any possibility that that patient, could be released from the hospital soon?
She's still in the ICU.
She is, okay.
Yes.
Dr. Jansen, how is the staff holding up? This was a very traumatic day. Talk about how the doctors and nurses are.
The impact of this on the staff is something you can't imagine. Unfortunately, this day and age, seeing shooting victims is almost a daily occurrence here. And we have multiple shooting victims come in every day. But when they come in like this, particularly because it happened in a healthcare setting, it resonates more and it creates angst, as you would imagine. So we've provided support as best we can. We've spoken with the staff and we have support staff to help them through this.
Dr. Jansen, can you give clarification? Do you know if these women who were shot, how many, or if any, were actual employees at Northside Midtown, and how many were patients in the waiting area?
I don't know. I didn't ask them nor their families if they were employees versus patients. I know there were probably some employees and some patients, but I don't know the mix.
But the hospital was prepared yesterday. You had enough staff.
Yeah, we drill for this frequently. And, sad commentary, the number of injuries that we received yesterday at one time is not an unusual event. We initially thought we were going to receive 12 patients, so we had rooms open for 12 patients should they come. And we had those fully staffed, physicians, nurses, ancillary staff. They were all in standby waiting for the patients to arrive. So by the time the patients got here, everything was in place.
Hey, Dr. Chancellor, when you're in an active shooting situation, everything could change in a moment.
Yes.
You could have many more patients that are shot and wounded, right?
Yeah, and there's always this fog of uncertainty, during the event. Yeah. That's the reason we initially were told we had 12 patients. Fortunately, it was only 4, and we're only grateful for that.
For the patients that you have been able to speak with, were the other ones not awake that you weren't able to speak with them?
They're in critical condition and can't speak.
So as the manhunt continued, was the hospital on standby for any other further victims into the evening?
Yes, we're always on standby, unfortunately, yes.
The resources that are available for the hospital staff, they do need to turn to someone after
So I could.
The resources available for the hospital staff here after going through a situation like
Yes.
this, what's available?
We have psychologists that meet with our staff. We have chaplains, obviously our social work staff, so we have a number of people who are able to meet with our staff. Okay.
What does the road ahead look like for all of these patients?
Physically, they all have a ways to go. I think psychologically and mentally we have to also remember that, the impact on them and their families. You know, you can't underestimate how traumatic this is, and they have a long way to go.
Dr. Jansen, how many of the patients are alert, conscious, can talk to you out of the 4 shooting victims?
I've spoken to 2.
To 2 of them?
Yes.
And can you share any of that, what they said to you about this? Or?
You know, they have been traumatized. They are very grateful for the support and care they've received. They realize that this is a horrific event, and the fact that they were in a healthcare facility is worse. But they were incredibly grateful.
Do you anticipate any further updates today?
I defer to my.
Thank you guys.
All right, thank you.
That's it
Thank
for
you very
now.
much,
Thank
Dr.
you. We'll keep
Jansen.
you
Thank you.
updated.
There you have it. We just heard from Grady Hospital's Chief Medical Officer, Dr. Jansen, giving us an update on the 4 victims that were taken to Grady Hospital after the Midtown shooting took a very tragic turn at Northside Medical in Midtown on West Peachtree yesterday afternoon. Here's what he said about the victims right now. 3 of them are in critical condition at this time. 1 is stable and the 4th victim is in ICU. What we know about 2 of the victims today, they're going to undergo another surgical procedure because he said you can't do everything the day of the tragedy, so that is routine and scheduled. Miraculously, 2 of them were able to talk to Dr. Jansen and tell them about this experience. One of the notable things saying that they are grateful for the community support. Again, the 3 victims that were in critical condition, 1 stable, 2 will undergo surgeries later today. Ariana Maniz is there. We're going to hear from her again coming up at 12:30.